I'm Ms. Deepa Ranganathan, founder and CEO of Aieraa Overseas Studies, and we are here to partner with one of the best universities in Vietnam, in Hanoi City, the Dai Nam University of Medicine and Pharmacy.
Hi, I am Avinash, founder, MD of Aieraa Overseas Studies.
So, Mr. Rector, can you please introduce yourself?
Yeah, okay. My name is Chau. I'm Rector of Dai Nam University. Yeah, thank you very much. And we are very happy to cooperate with you for the medicine, for the Indian student for medicine at Dai Nam University. Yes, as you mentioned before, Dai Nam University, we prepare everything well to welcome for the Indian student here. And yes, our campus is located in Hanoi. Yeah, it's in Hanoi. So with nearly the 10 hectare, which is large, so we prepare all the infrastructure is enough for our cooperation in Cambodia.
10 hectares used to call in India 25 acres, sir. 1 hectare, 2.5 acres in India.
Right.
Yes.
Yes. Right. Yeah.
Great, sir. In heart of city, 25 acres is not easy to...
Yes, because we are located in the center of Hanoi.
Okay.
And it is easy to travel from here to the downtown.
Okay.
Yeah, we can go to downtown by many different ways, by car, by motorbike, or even by the bicycle. And it's especially we have a train.
Train.
Yeah, train.
Fast train.
Train, okay.
Yes.
Local train.
Yeah,
Yes.
local train.
I just saw that very close to the college, right?
Exactly.
Track was just,
Yes.
just 50 meters from the college.
Yes.
Yes.
Yeah.
It is. We located it about 500 far from the station.
Oh, 500 meters from the station.
Students from the campus can go walk to the station.
Wow.
They can take train to the downtown. Yeah, and they can go to travel to discover about the downtown of Hanoi, Vietnam, and it's easy for them to go back to the campus.
Great, sir. Great.
So that's a very good thing about the Dai Nam University.
Yeah.
And thanks for introducing yourself, Mr. Rector. Miss, can you please introduce yourself
Yes.
to our students?
My name is Phan. I am director of the international office. So I'm in charge of all the cooperation activities with international organization, universities, as well as the student exchange programs, and develop dual degree pathways.
Okay.
Yes.
That's very good. So you are also supporting the students for their pathway programs to other countries, right?
Exactly.
So then the students, you will be very busy from now. We'll disturb you a lot because our students, Indian students, like to explore in every country. They of course, majority of them wants to come back to India to practice, but there'll be a lot of people who wants to go to US or UK or Australia,
Yes.
or maybe some students like Vietnam. In fact, the students who are already studying with us, there's few of them, they want to become a doctor in Vietnam itself. They like the country.
Yes.
So we Indian can live anywhere.
Exactly,
they have this capacity of adapting the new environment, new culture, and new people. So your office is going to be really busy, madam, after our students come. Yeah. So, sir, now let's we have some few clarifications or few questions to be asked, and we need answer from your side. So, what is your plan to have Indian students in the campus, and how are we going to provide them the best academics in terms of teaching or learning system and the libraries, everything in details?
Before talking about and answer your question, I want to mention here one thing related to the international strategy for Dai Nam University. Because since established from the university, Mr. Chairman, he wants to make an internationalize our university. So we prepare everything for that strategy. So you can see that from the infrastructure, from the programs, in general program, we have an international semester where we can send our students to the overseas and where we can welcome the international student to go to here to study. That is curriculum, open curriculum for international purpose.
Okay.
And we also create the diversified culture. It's international culture where it is easy for international students to come here, to stay here, and to communicate with our local students. And of course, we also prepare and many other things, as you mentioned, from the food, international food, and from the accommodation, and something related to our internationalization strategy. So, return to the story of Indians medicine training.
Yeah.
Since we met each other, so we also prepare many things related to the academic issues, from the curriculum, from the programs, from the textbook, and also the most important is a lecturer.
Okay.
Yes.
Okay.
We prepare that for
Okay.
this program.
Okay, so can we go in detail, sir?
Yep.
So from the curriculum point of view, what are we going to do when it comes to the medical program for Indian students? Because we follow the National Medical Council norms of Indian students that has a set of guidelines to be followed in terms of the curriculum.
As you can see that the Vietnam and the Indian, we have separated the medicine system and training system. But luckily, the system of the medicine of Vietnam is quite similar
Yes.
Exactly.
to the Indian.
Yes.
For
Agreed.
example, we also is conducted for the 6 years.
Yes.
Yeah. So it is a very convenient for us for Dai Nam University when we design curriculum.
Yeah.
So based on Vietnamese medicine curriculum, which regulated strictly by the government, we also to look at the Indian program for medicine regulated for the medicine. So we combine
Okay.
to create about the program which is suitable with Vietnamese program and also with the
Indian program. So the Indian students will also get the program what they require. So that's how we are going to have it.
Yeah.
We will be having a program which has a combination of Vietnamese requirement and the Indian requirement. Maybe
Yes,
there will
right.
be are we going to have any mapping with the subjects and the lessons so that if anything is missing from the Indian program in the Vietnamese syllabus will be added in the curriculum. Am I right, sir?
Right. This is right.
Yeah. Thank you, sir. So in terms of the language, it's going to be the medium of instruction is going to be English.
Yep.
Perfect.
Of course, English is a big problem. Yes, we also aware about that problem. So we have two solutions. Firstly, we recruit almost the Vietnamese lecturer who graduated from the overseas,
Okay.
especially from the Europe,
Okay.
from the US.
US. Okay.
Also, some our teacher graduated from India.
Oh.
Yeah, they are very good at English.
Okay.
And also its culture. So it is the first. And the second thing is we invite different lecturer from native speaker,
Okay.
native English speaker, like from Indian
Yeah.
and from Singapore.
Okay.
Yes, and also it's from Europe.
Okay.
Especially, we expect that you also introduce for us about the Indians lecturer.
Yes, sir. Yes,
Who
sir.
is understand about the Indians culture, understand about the Indians students.
Yes.
So it's much better for.
Yes, because to have Indian lecturer in the campus, the advantage will be One is the Indian students can get related very easily, can be easily connected to the lecturer. And two will be the Indian lecturers will train the students after the college hours for their licensing examination in India.
Right.
So we need to have that. Are we planning to have any coaching along with the regular curriculum to train them for the licensing exam, sir?
Right. Yep. And this is a very important issue. When I exchange with our Mr. Chairman, he also strongly support for inviting the Indian qualified lecturer to Vietnam to teach from the first year. From the first year, not only from the third or the fourth year. From the first year, we expect invite to the Indian lecturer to come here to teach.
That's great, sir. So from the first year, we'll be having an Indian lecturer to teach the students. We'll be having 90% of the lecturers for medical program for India will be from India, right? Yeah,
yes.
That's what the chairman also mentioned in the interview. Yes, sir. So regarding the library, how are we going to keep the library well equipped with the English books for the Indian students?
For library, we also prepare the library in our campus. Firstly, we have the library where we design for the very large space for Indian students to stay there to learn and to study.
Okay.
Wow.
We also design special area with the fit with the Indian shape students.
Okay.
Because the Indian student probably is bigger than the Vietnamese students.
Yeah, the other students were finding it a little difficult because of the desk, the furniture was a little different from the Indian students. Yeah.
That is one thing. And the second thing is we have the electronic library, where we connect with the different libraries from different university, not only in Vietnam, also university from the overseas, like in US and Korea and in China, and we expect that from India.
Definitely.
They are our partners.
Okay.
That is for
E-library is always good.
Yes, e-library for our students.
Because e-library give an opportunity for the students to go globally. You get a global understanding, and you can get access to almost all the textbooks and the journals or everything. From every part of the country.
Yes.
So you don't need to be confined with the 10 or 100 or 200 textbooks. E-library gives an opportunity for the student to access thousands and thousands of books, workshops, everything from the case studies for medical program, because medicine is something which is universal, and every place, every country, every city has a different kind of diseases and different way of treating the disease. So when you get more exposure in the medical field, the students get more knowledge, and they become more intelligent, a better doctor than anybody else. So that's a good idea, sir.
I also want to add one more point here related to the library. Here in Vietnam, we also have the medicine library managed and under the Ministry of Health.
Okay.
It is a very, very diversified resources related to the medicine textbook and reference book in English.
In English. Okay.
Yes.
Okay.
So we did have agreement with the Ministry of Health for our students to have the account to use that library. That is useful for.
That's a very good thing, sir. So the students can use the medical library, which is with the Ministry of Health, and especially in English medium, for them to access lots more of books and more journals from many doctors across the world. So the library is a very important, because why I raise the question for library is, we can't carry too many books from India and come, and they should get an access for the research purposes, or if they want to write any papers or journals. This will be very important for them, sir. We request you to add Indian author books also in the library, so
Yes.
that will be a
That
very
is, very useful for our Indian students.
yes. So now let's I want to have a little more discussion on the teaching methodology and the training program. So how are we going to have? What are the laboratory facilities we have? What are the lab facilities in the campus we have for the students, for the training, for the practical training, and what is the kind of teaching methodology we follow in this university?
Yes, talking about the methodology, we want to emphasize two different things. Firstly, we base on the methodology where we use case study, almost a case study research for our student. The second thing is we base on the laboratory where we force our student to make a practical and experience from the hospital and also with the laboratory at our university. And also another very important thing is because you can imagine that the AI is very strongly developed.
Yes.
So at the Dai Nam University, we apply to AI in teaching. I mean that the student can self-study and can use the AI before they go to class. So our lecturer can explain and can answer their question and their problems.
Oh, okay.
That means that we can say that it is a problem-based methodology.
Okay. So when we have a lot of digital learning, that's what you're trying to say. The AI will help the students to learn before they go to the class.
Right.
Maybe to understand the subject or the topic what they're going to be taught on the day, and that will help them to ask more questions to the teachers. And you are going to have one of the best professors in the world. You're going to have professors from US, from India, from Europe. So they will help the students to go a little more deeper in the subject. So the AI method of learning is actually today's world. Everywhere it's the same. Do we have any kind of guest lecturers? Do you provide any guest lectures from other parts of the country? Whether the lecture from any other university in Vietnam or outside Vietnam, they come to the college and they take some workshops or lectures? Is that done?
Oh, yeah, it is a very important point which you mentioned. One another for the methodology I want to add on, it is, how can I say, is using the LMS, it's a learning management system.
Yes.
Because we invite the international lecturer from different countries. They not always go to the campus to teach, but they can stay in the US to teach. So through the LMS, student can exchange and can learn from the lecturer from the US or from the India, for example. That is one way which we focus on.
So we have a learning management system. Does the learning management system, the LMS, will also track on the records of the students, the academics, their attendance, everything, sir?
Right.
Yeah. So are we going to share this with the parents also regarding the progress report and the academics of the students? Because the parents are sending the students from India all the way here, and they always have the fear of knowing that whether the ward is actually attending the classes properly, or they're going to get good marks, or they're good progressing in the report, or is there any decline in their academics. So will this LMS will be incorporated with the company and the parents to know their academic records?
At Dai Nam University, especially for medicine students, it is very strictly to participate and to go to class. Especially for the theory lecturer, they have to go to class at least 80%.
80% of
80%,
attendance is
yes.
compulsory.
So it is a theory.
Okay.
For the experience and practical session, they have to participate 100%.
So
Not less.
I'll repeat it, sir. For theory, the students must be at least 80% in the class. Their attendance should be minimum 80%, and for practical and hospital training, it should be 100%. 100%. There is no way that a student can miss the class.
Why? There is no way to pass that subject.
Yes.
And that is one way which we manage by the quality system management.
Okay, so we had a very good discussion about the library and regarding your LMS system. So will the parents will be able to access the progress report or the academic records of the students, sir?
Oh yes, it is a very, very important point during the training process at Dai Nam University. So for the Indian students, we have the system where the parents of students can access about the track records, about the information during the time students study here.
Okay.
Yeah.
That's very good, sir. So that keeps the parents in a very comfortable place where they know what the student is doing in the college.
Right,
They
yes.
have really spent a lot of money and time to send the students to the institution, and if the students they need to know whether the students are studying well or doing good in the college.
Right, because for the local students, after each semester, we send our information from student to the student parents.
To the parents,
To make sure that their parent knowing and understand about the process of our students to study at the university.
So during this process, sir, I have another question to ask. If the student is not good in academics or is declining or not really up to the mark, so are we conducting any kind of any techniques or any method to improve the student in academics, or what are we doing?
Yes, we have two systems. First is mentoring system. We have mentoring who is working directly with the students every day to help them improve everything they are challenging.
Okay.
The second thing is we always inform to our dean and our lecturer to knowing about this situation of our students to help them to understand about the lecturing and everything.
Okay. So the mentors will help the students to understand the difficulty in studies, maybe a psychological, a shock, a cultural shock, or a homesickness, or maybe some students may not understand the teaching methodology. So the mentor will help the students to make it better and easier.
Yes, the mentor.
The mentor.
They can.
Yes. Thank you, sir. So let's go talk about the infrastructure, sir. What are the laboratories we have in every department?
Yes, for laboratory, we prepare enough for the learning process from the first year to the sixth year, and with different 9 separated rooms. So students will be the separated group to practice for each subject from the beginning to the end.
Okay, very good, sir. So do we have a simulation lab with us, sir? Simulation department lab?
We also prepare the simulation lab for the training process. They also included about the male and female Cinderella. And also included the biochemical facility, laboratories.
So in the anatomy lab, what are the facilities we have in the anatomy lab, sir? In the anatomy lab,
Yes, yes, we have.
So we have a male and female Sindavers.
Right.
So
yes,
now
this is very important.
very important, because now WHO has given an instruction to have Sindavers instead of cadavers, because cadavers cause a lot of pollution around us. So Sindavar is a better way of students to for the dissection and
Right.
things. So, and we also have do we have the anatomy table, sir?
Yes, we have.
So that helps the students to understand detail, and the teachers can
Right.
explain it in
Right.
very detail.
Right.
Yes. So regarding the simulation lab, what kind of simulation lab we have, sir? Do we have a basic level or an advanced level simulation lab?
Yes, we have. We invested a lot for this.
Okay.
Yeah, totally is nearly 2 million
Oh.
we invest for the laboratory with this.
Okay.
And we import different parts and category from Europe
Okay.
and other countries for the
Simulation lab.
Advanced
So we
simulation
have an
lab.
advanced simulation lab,
Right.
the latest simulation lab.
Yes.
So how are you providing, sir? Are you providing what is the space occupied by the simulation lab? How big it is?
We have a different room and space, and included the 9 different rooms for
Okay.
the laboratory.
Laboratory. So in simulation lab, do we have every department like the ICU, the pediatric department, OBG, the ortho, and you have the surgery department, like where the students learn how to get into the surgery room and come out.
Cardiology.
Right. we have.
Cardiology, yeah.
Yes, we have.
Yeah, so we have all the departments in the
Yeah,
simulation
yeah.
lab. So the students will have the best infrastructure where they can have a training in one of the best simulation lab. So while talking about the simulation lab, we would also like to understand when the students will start the hospital training.
For the hospital training, right?
Yeah.
Hospital training, we prepare for our curriculum start from the first year.
First year, so
Yes,
that's a
first
very
year.
big news, sir, because we usually in any of the universities, the hospital training will start from third or second, end of the second or third year. So you start the hospital training from the first year onwards.
Why first
First
year?
semester or second semester?
Second
sir?
semester.
Second semester.
Second semester.
Sem- Second semester. Because it's the first semester, they will study almost is a theory and basically subjects.
Okay.
And they also have to study the Vietnamese subject.
Yes.
Oh, yes.
Yeah.
They practice.
So
Yeah.
we prepare for the second semester in the first year.
Okay.
Why? Because our curriculum is designed aimed at helping the student to understand through the hospital and practical.
Oh, that's really great, sir. So when the students can have hospital training from the
Yes.
first year, the students is going to have 6 years of hospital training. So that will make them the best doctor. So I understand from the conversation that they will be having the training with the simulation labs in the beginning, the first semester, and from second semester, students will be allowed to go to the hospitals. Yes, sir, that's a very good thing. And in fact, the chairman was mentioning that he is going to have a clinic of outpatient and inpatient in the campus. So that is going to be a very good advantage for the students to get the training inside the campus itself.
Yeah.
And I also understand, sir, from our discussion that you have collaborated with Hanoi Medical University also.
Yes. Right.
Yes, sir. Can you please explain about that, sir?
As you may know, that Hanoi Medical University is the most traditionally university of Vietnam. It is more than 120 years.
Yes, sir.
So we have cooperate various time with them to use facility and to invite their teacher to help us to teach during the time to start student to study.
Very good, sir. If a student can get an opportunity
Yeah.
to get trained in Hanoi Medical University, nothing better than that, because Hanoi Medical University is the 7th best university in Asia. So that's one of the best university.
Yes.
And as you mentioned, sir, it's a 120 plus years old university. So that university, the students of Dai Nam University will be getting an opportunity to get trained in Hanoi Medical University and also being taught by the professors of Hanoi Medical University. That's a very good. So it's like almost they are studying there. So we can say that we also did in Hanoi Medical University. That's a very good thing, sir. Sir, regarding this, the program, this will be mostly my last question about academics. Regarding the program, what is the 6 years program? Is it including the internship of 1 year?
Yes, we also design for internship for our students from during the time they study here.
Okay. So this 6 years of program is included the 5 years of study and 1 year of internship. Am I right, sir?
Right.
Yes, sir.
Okay.
Now we have 2 international hospitals for our students to practice there.
Yeah.
Okay.
And beside that, we also have an association of private hospital
Okay.
where it's located in different areas in Hanoi and other provinces for our students to be internship there.
Yeah. So by understanding with you, the students will be having the internship, the practice in an international hospital in Hanoi.
Yeah.
So the language is not going to be a very big problem because you get a lot of international patients also in that. And whether the students, after the completion of the course, maybe the students can get an opportunity to work in the same hospital. Am I right, sir?
Right. I also want to mention one more here is why international students, why international hospital? Because it's a barrier of language.
Yes.
And for this barrier, we also look for the solution where we can send our students, Vietnamese students, who is very good at English, to go together with the Indian students.
Okay.
And for the international hospital, almost their staff can speak English.
Okay.
The doctor there can speak English. So it's easy for the Indian student to make a question and to understand about the explanation from the doctor there. That is why
It's very, very good, thoughtful thing, sir, because the students may not feel different because we have those friends. Through friends, they learn Vietnamese easily, and they also help the students to translate for them. So that's a very good thought, sir. Now coming to ma'am, Miss Fong, if I'm pronouncing it right. Yes, Ms. Fong, the Director of International Department. So now this is a very important factor what we are going to talk, because the students, when they come from India to Vietnam, the first they have a cultural shock. Of course, we are Asians, we have the similarities, a lot of similarities in terms of our behaving, the terms of our eating habits and everything, but still there will be a cultural difference from India to Vietnam. And how are we going to have support the students in terms of in adapting the culture, the environment? And I also want to ask you about the hostel facilities. How are we going to support the students for their hostels, housing facilities and food? So you being the International Department Director, so you will play a very major role in handling the Indian students here. So we'll be disturbing you every now and then in terms of students management issues.
Yes.
Because I can see in Dai Nam University, the academic part of the situation is almost sorted. So Mr. Rector have explained how beautifully he is going to train the students with this new methodology, including the artificial intelligence in the training methodology, and also his LMS system to track the progress and everything about the students. So that is going to help the students, and I know, sir, you are going to give us the best doctors. There's no doubt, and with the vision of our Honorable Vice Chairman, we can understand the vision of Dai Nam University, how we are going to work together and create one of the best doctors for the universe.
Yes.
Now it's your role, madam. Your role is major role, because day-to-day issues, you are going to handle everyday situations with the students. So please tell us.
Thank you. So at Dai Nam University, we are committed to ensuring that Indian students feel supported, welcome, and well integrated from the moment that they arrive. So our international office will work closely with the faculty to ensure that the student have a smooth learning experience. And also we have now the rector just mentioned, we have the orientation and buddy program in which each Indian student will be paired with a Vietnamese student so that they can help each other to integrate faster. And also we have dedicated living spaces. So when the Indian students arrive, they will stay at our 15-story newly built dormitory with separate floors for male and female students. And we have 24/7 surveillance and 2 supervisors in each dormitory.
Okay.
Yeah.
So 24 hours surveillance, you have a camera.
Yes.
The major common areas.
Yes, like the hall and yeah.
Security.
Yeah.
Yeah.
And you'll be having 2 supervisors who will be taking care of the students.
Exactly.
That's a good thing.
And then we also have a 24/7 hotline so that the students can call anytime that they need with urgent concerns or daily life support.
Okay.
Yes, and then we also have the psychological support center to help the students with emotional well-being, the stress management, and other mental health concerns while they study far away from home.
This is a major point, madam. This is a very important point. We need to have a psychological health center, because most of the students they will be little have a homesickness, because Indians have been in our home we are more pampered. Even at the age of 30 or 40 we still listen to our
Yes.
parents. So we are not
Yes.
like any other. Well, maybe after 18 other countries they're free. They can do whatever they want to do. But in our home, even at the age of 40, we listen to our parents and we follow them. So we have been always guided by somebody. So suddenly if we are left in a place without any guidance, we get shocked. So this idea of having a counseling center is the best thing. So their issues or their any psychological problems can be addressed right then and make them a better student to study.
Yes, so the head of the psychological support center is the doctor of psychology from Switzerland.
Oh,
Yes,
that's great.
she speaks English very well, so no worries for the students.
That's really good, ma'am. That's
Yes.
a very thoughtful approach. Not only providing the hostels and you give them a separate girls and boys accommodation, you provide the supervisors and you also provide the hotline center. That's very, very important, because the students in the middle of the night, if they are sick or if they need some urgent help, they can
Yes.
immediately reach. So the hotline is 24/7 available, madam?
Yes, 24/7
so anytime
available.
the student can call the hotline for the emergencies. And regarding anything else, what are the support are we giving for the students to understand the culture and the nature?
Yes, so we also provide Vietnamese courses for Indian students who are eager to learn about Vietnamese culture, Vietnamese language. Yeah, so
Okay, so that's very important, madam. I also insist the college to teach the maximum Vietnamese language in the first year, because once they get access to the patients, they need Vietnamese language. So we can, during their free times, during their extra times, they can also learn Vietnamese language by themselves. So if you can support with some tools or something for them to learn by themselves also, some online tools or something.
Yes, I want to add on one thing here. As you know that for the first semesters, it is compulsory to study the Vietnamese language. But within the Vietnamese language, it is not only teaching about the language. We teach the student about the Vietnamese culture, from the communication, from the wearing, eating, and everything, to make sure that the Indian student to understand and to help them to, it's easy to study here and to communicate with Vietnamese students. And the second thing is we also thinking about the way that is clear for the buddy. What buddy? Buddy, that means we want to each Indian student will have one Vietnamese student to be their buddy.
Okay, buddy.
Yes, to support and to
To
help
be a
them.
buddy.
Yeah.
The buddy,
Easy,
yeah,
yes.
that's
Yeah,
nice.
It's
Yeah.
easy to overcome anything.
Yes.
Exchange the language.
Yes,
also.
change.
Exactly.
Yeah.
It's like a student mentor program.
Exactly.
So it's called a student mentor program. So each student will have, Indian student will have a Vietnamese buddy who can speak good English so that they can talk to them, they can understand the language. Either of them will be benefited by knowing
Right.
each other and the culture
Yes.
of the thing. That's a very good
Yes.
plan, sir. Very
Miss,
good.
what are the facilities you are providing in the hostel? Dorm?
Oh, we provide a washing machine, refrigerators, air conditions, and other necessary amenities.
Great.
Yeah.
Great.
That's very
Yes.
nice.
And also it's bad for little.
Of course,
Of course.
of
course,
you
yes.
provide a cot and a bed.
And then I'm not sure if the chairman has mentioned or not, but we also have dedicated dining area and kitchen for the students.
Indian
Yes,
student.
for Indian
Oh,
students, yeah. And we also have a study table.
Yes.
Everything.
Yes. We
So do
have.
they have any special study room apart from the room? They're sitting in the room all the time. Do they have any common area where
Yes.
they can sit and study and work? There?
So each floor has a common room for the students to come and enjoy their time together. So in the common room we have like a table and TV and other like entertainment for the students as well.
It's like more than a home. I don't think so many students in their home they have lots of facilities like this. Yeah, it's more than a home and for a very affordable price, madam.
Yes,
Cost is
the
very
price is very
that's very
affordable.
important.
Yes. So we also provide religious and cultural accommodation. So we have just accommodate prayer rooms for the students and other necessary religious accommodations for the students if they request. And then we also have an Indian coordinators to help the student to feel like home, and whenever they need to ask anything, they can go to the Indian coordinator to ask. Yes.
That's a very good thought, madam. To have an Indian coordinator in the campus is a good thought, and we are very thankful for that because we understand Vietnamese are very sweetest and nicest people I've ever seen in my life. We travel to many countries, but when the Indians, they feel little more closer, more connected with the Indians coordinator. So
Yes.
that's the thing. So they will be available here all the time, 24/7. So that coordinator, students can approach to him if he or she, if they have any doubt, any clarifications or any requirements from the college. Yes, sir.
And then at Dai Nam University, we offer more than 30 student clubs. So ranging from sport clubs like volleyball, football, basketball, to yoga, dance class, and fitness. And then we also have scientific research to other academic groups, so that the students can choose the activities that are go best with their interest. And then we will also hold different cultural exchange activities, so that the Vietnamese students and the Indian students can interact to understand better each other, and then have develop greater friendships together.
That's beautiful, madam. When we spoke about the research, so how far the university is going to support the student in the research activities, sir, during the course of the study?
Sure. Because research is very important in the university, especially for the medicine students.
Yes.
COVID teaching us, sir.
COVID taught us how much research is important.
Well, actually, we have a lot of partners, international partners from the US, Europe, Asia, and we're in discussions with them regarding the research collaboration in medical and other faculties in the healthcare sectors.
Oh, that's good.
Yeah.
madam. So we can also bring some partners from India also now for research
Yeah.
collaborations in future. So that's good. So students get an opportunity to do the research activities also along with the course of the study. So that's a beautiful thing to have it, sir. Because many colleges, they don't have a they don't give the opportunity for students to do research. They study the syllabus, the curriculum, they get trained in the hospitals, and they're done with the course. But research is a very, very important aspect, an important area in the field of medicine. Because without research, we don't have any of our medicines in whatever we are doing.
Exactly.
We have, and I also want to add on one thing is,
Yes, sir.
because of Dai Nam University, we cooperate with the Ministry of Education and Ministry of Health. So they have different program support for research.
Okay.
With so the Indian students and also the Indian lecturer can join with us to be the member to implement some different research related to the medicine during the time they study and they teach here.
Oh, that's good, sir. So the professor who is going to come to teach the students can also be a part of the research program. So that will also help the professor to enhance his knowledge in research. That's a very good opportunity, sir. Now you are giving an opportunity for the Indian doctors also.
We expect, we expect.
And then we are also discussing with our partners to develop clinical exchange programs so that the students can have the opportunities to come abroad to do their internship. Yeah, I think that's a very good opportunity for them.
So we have a lot more to go, and we are very, very, very happy to be partnered with Dai Nam University, sir. We have almost we got most of the informations from you, and this will be enough for our students. This is more than enough for us. So
Thank you.
I think the students will be happy to be joining this university under your guidance and support. They become one of the best doctors.
As you understand that we also prepare very well for this program, and with our experience more than 6 years for the training in the medicine. We hope that it is enough and it's well for our students, for the Indian students to come here.
Sure, sir.
Yes.
Sure, sir. Thank you very much. Thanks
you.
a lot. Thanks for your time, Miss. Thank you. Thanks for your time, sir. Thank you so much.
You're welcome.
Thank you.
Thank you.